Autism is a fascinating part of the human experience. It's a different way of thinking and being in the world. People with autism are unique, just like everyone else. They have their own strengths, talents, and challenges. Diagnosing autism early is very important. It helps us understand and support people with autism better. When we know what to look for, we can provide the right tools and strategies for success. Early intervention can make a world of difference. Imagine a child with autism as a seed. With the right care and support, this seed can grow into a strong and beautiful plant. Early diagnosis is like giving that seed the best possible soil, sunlight, and water. This guide is here to help you understand autism diagnosis. Together, we can create a more inclusive and supportive world for people with autism. Autism spectrum disorder, or ASD, is a developmental disability. It affects how a person communicates, interacts with others, and learns. Spectrum means that autism presents differently in every individual. The signs and symptoms of ASD typically appear in early childhood. They can range from mild to severe. Some people with ASD may need minimal support. Others may require more substantial assistance. There is no one-size-fits-all approach to understanding autism. It's about appreciating the diversity within the spectrum. Early signs of autism can be subtle. Parents and caregivers are often the first to notice that something is different. It's important to remember that every child develops at their own pace. But if you observe any of the following signs, it's crucial to talk to your pediatrician.
Some common early signs of autism include limited eye contact or difficulty with social smiles, delays in language development such as babbling or speaking, repetitive behaviors like flapping hands or lining up toys, and unusual sensory sensitivities such as aversion to loud noises or certain textures.
It's essential to note that these signs can vary widely. Early identification and intervention are key to supporting children with autism. Screening is a way to identify children who may be at risk for autism. It involves simple questionnaires and observations. Pediatricians often use screening tools during well-child visits.
One commonly used screening tool is the Modified Checklist for Autism in Toddlers, also known as the MCHAT. This checklist asks parents a series of questions about their child's development. Screening does not diagnose autism. If a screening tool indicates a potential concern, further evaluation is necessary.
Diagnosing autism is a comprehensive process. It usually involves a team of specialists, including
Developmental pediatricians, doctors who specialize in child development.
psychologists, experts in behavior and mental health,
Speech-language pathologists, professionals who assess and treat communication disorders.
The diagnostic process may include developmental history, which involves gathering information about the child's development from parents and caregivers.
Observations. Watching the child's behavior and interactions in different settings.
Standardized tests, using structured assessments to evaluate the child's skills and abilities.
A diagnosis of autism is made based on the child's developmental history, observations, and test results. Section 6. Navigating the Maze. Challenges in Autism Diagnosis.
Diagnosing autism can be challenging. The symptoms of autism can overlap with other conditions. This can make it difficult to determine the underlying cause of a child's challenges.
Furthermore, autism presents differently in boys and girls. Girls with autism may be underdiagnosed because their symptoms can be more subtle.
Cultural and linguistic differences can also impact the diagnostic process. It's essential to have culturally sensitive assessments and professionals who understand the child's background.
Section 7. Distinguishing features, autism versus other conditions.
Differential diagnosis is the process of ruling out other conditions that may share similar symptoms with autism. Conditions that may be considered during differential diagnosis include
Attention deficit/hyperactivity disorder, also known as ADHD, anxiety disorders, intellectual disability, language disorders.
distinguishing autism from other conditions requires careful evaluation by experienced professionals.
Section 8. The Power of Early Intervention. A Brighter Future. Early intervention is crucial for children with autism. It can help them develop essential skills and reach their full potential. Early intervention services may include speech therapy, improving communication skills; occupational therapy, enhancing fine motor skills, sensory processing, and daily living activities; behavioral therapy, addressing challenging behaviors and teaching social skills. Early intervention is most effective when it begins as early as possible. Section 9. Embracing the journey. Support and resources. Receiving an autism diagnosis can be overwhelming. It's important to remember that you are not alone. There are many resources available to support you and your child. Some helpful resources include Autism Speaks, provides information, resources, and support for families affected by autism. The Autism Society offers advocacy, support groups, and educational materials. Local autism support groups connect with other families in your community who understand the challenges and joys of raising a child with autism. Remember, an autism diagnosis is not the end. It's the beginning of a new chapter filled with possibilities. With the right support, children with autism can thrive and lead fulfilling lives.